Being professional in the chiropractic profession is a lot more complicated than in other healthcare professions because doctors of chiropractic have a more hands-on relationship with their patients than other healthcare fields. The best thing to know, the most important thing to know, however, with boundaries in your patients is that the patients set the boundaries. Regardless of how professional you think you may be, your patient is the one that sets their boundaries for their care. So the best way to protect yourself and your patients and ensure that you're giving the best care to your patients for your physicals, is to always let the patients know what you're doing and why you're doing it. Give clear and concise instructions on what you want your patients to do, how you want them to lay, and why you want them to do so. If there's any clothing that needs to be removed or moved, let the patients know and let the patients remove or move their clothing, or ask permission if you can. And in that sense, if you're asking permission to move their clothing or remove it, you will have to explain why. And then also, when it comes to touch, you definitely have to understand that not every patient understands or recognizes the same touches the same way. Meaning, you can have an abuse victim as a patient that may think that touching their neck or touching their arm is a way of abusing them if you're not explaining to them what you're doing and they understand that I'm not trying to hurt you, I'm not trying to violate you in any way, I'm just examining your arm, or I'm just examining the muscles in your neck. Whereas another regular patient, if you want to say, will be okay with you just getting their arm and examining it, and it's no need to explain it. But you should always explain to your patients what you're doing, why you're doing it, and how you would like for them to be positioned, and then get their consent on that. So professional boundaries are always a number one priority when dealing with your patients. And not just with touch, also with the way that you speak to your patients and the way that you act with your patients in the room in order to not have them feel uncomfortable in any way. Always act professionally. Present yourself as a doctor would, or present yourself in a way that you would want your doctors to present to you and not make you feel uncomfortable. So I think the best way is to put yourself in your patient's shoes and treat them how you would want your doctors to treat you or touch you if they have to when you are getting examined.